All right, we're going to go ahead and get started to respect your time since you all were here before 6. Can't hear me? I think it's on. I don't have it high enough, maybe? How's that? Is that better? Okay. Well, thank you all for coming. This is our second meeting of ACAP Cape Fear. And if any of you are not familiar with that, it stands for Adult Children of Aging Parents. So all of our programs are geared toward the adult children, but yet it's also helpful information for those that are looking for information for themselves or also professionals for being a resource in our community. So thank you so much for coming. And my name is Dorothy Griffin. I've had the pleasure of working with a leadership team to put together these programs and to bring ACAP Cape Fear to our area. ACAP was started about 10 years ago by a family caregiver in Hickory after and that's actually her right there, Frances Hall, and she was a caregiver for her mom and really saw the need for some resources. And so that's how it got started. And our mission is to provide information, resources, support, and community. And we do programs once a month, same time, same place. And those are listed on one of the sheets at your table. It says ACAP Cape Fear at the top, and it lists all the programs through February so far. So make sure you grab that, and that will let you know what's coming up. And I just want to kind of give you an idea of what the evening's going to look like. I just have a few announcements, and then we'll hear from our sponsor. All of our programs are free to you thanks to the generosity of our sponsors. And then after that, we have 2 different presenters, and they will share their information, and we'll wrap things up at 7:30. We do want to know what your questions are, so we'll have time for question and answer, and they'll let you know how they're going to do that. So if you think of questions, make sure you get those asked. And if I forget to say it later, their table is on the back there, that round purple table with all of their information. So they'll give you some more information about Medicare, about SHIIP, and about the prescription program. So our sponsor this evening is Salinas Mondello Law Firm, and we have Amy from Salinas Mondello to just share a little bit about that. So thank you, Amy. Absolutely.
All right, I'm not going to keep anybody from the exciting stuff that's coming up, but my name is Amy Lalone, and I'm the Director of Operations at the Salinas Mondello Law Firm. I'm proud to be part of the leadership team for ACAP, and our firm is also proud to be a sponsor for ACAP as well. I think it's a really great service that we're providing the community, so we're happy to be a part of it. For anyone that doesn't know about our firm or has heard our name before, we are a small specialty law firm here in town. We only do elder law, estate planning, special needs planning, and then those little sub areas that come under those more broad categories. Our primary attorney is a nationally certified elder law attorney. She's got a master's degree in taxation, a lot of experience. So we do what we're good at. If you have a traffic ticket, don't come to us. But if you need one heck of an estate plan, come on our way. And we're just happy to be a part of this. I've got some stuff set up over here and happy to talk to anybody after if there's any questions or anything that I can provide. Thank y'all.
Thank you. I know you're here to hear our speakers, so I'm going to be brief, but if you need to use the restroom during your time here, go out these doors and you'll go down the hallway in this direction so that the main desk is on your right. It'll be the men's restroom first and then the ladies' restroom. And I was just going to cover a few more things on your table. If you're not getting the emails letting you know about our programs, you can fill out the little quarter sheet. And we do ask that everybody at the end will fill out the ACAP program feedback. And that just lets us know what we can do to make these programs better. And the other thing that's on your table is about the symposium. Once a year, they do a national symposium. This will be streaming. So that's on there also. So our first speaker is Pam Wall, and she is a native of Wilmington. She said she's lived here all her life. She's been the prescription assistant specialist for New Hanover County for over 9 years. And so she serves specifically our senior population. Before that, she was an adult Medicaid caseworker, and she really saw what individuals were facing with the high cost of medications and insurance. And so she's established a lot of great relationships with physicians as well as pharmacists. She's also been a former insurance agent. So she kind of has all the different pieces to put together to be a great resource for you. So let's welcome Pam Wall. Thank you.
Hi, good evening. I probably don't need this. I'm pretty loud. If I'm not loud enough, let me know. As she stated, I've been with New Hanover County Senior Resource Center for 9 years. And it really is, I found late in life really what my passion was. And it really is my passion. I always heard the need for assistance with the meds. It was taken away from their income with the adult population, from their retirement, from their savings. And you may not experience it yourself, but you may know of someone who experiences that hardship. So prescription specialist, what is that? So basically, Fred's going to talk with you about Medicare, but I help folks with unaffordable meds. And what I do, it's the old, I guess, caseworker that I used to be. I still wear that hat in so many ways. So when you come to see me or call me or refer to me, we do just a brief assessment so I can find out what your needs are, what medication, whether it's an insulin, whether it's an inhaler, whether it's a heart med, any other name brand med. Generally name brands is what I work with. And also another thing, 99%, I would easily say 99% of my clients have insurance. So just because you have insurance doesn't mean you don't have that need, especially if you have Medicare. And are any of you familiar with the donut hole or gap coverage? Any of you here familiar with that? So that is a tremendous hardship for our Medicare population. Folks, I didn't know about it until I got involved with Medicare. Commercially insured folks, you don't have that gap coverage. So what I try to do is help the client to, even though it's on their insurance plan, I still want you to make sure it's on your Advantage plan or your Part D drug plan, even if I'm assisting you to obtain that medication free. So I've talked in circles a little bit. What I do is, if you, for example, come to me, I'm struggling with insulin, or I'm struggling with this heart med, I do an assessment. I tell you what I need you to have in front of you. We schedule a phone appointment. It is by appointment only. We do it over the phone. You don't even have to come in and see me. You could sit and have a cup of coffee. I could be drinking coffee. And we go through, and only thing that I'm looking at is your income. That's it. You could have $75,000 in a bank account, $100,000 in a bank account. It's determined as far as eligibility by income only. It's not like our locally funded programs or state programs with Medicaid or extra help, and I'll mention that briefly. They look at your resources and they look at your income. The pharmaceutical programs, which is what I go through, they're there to assist those who have maybe a little higher income, but by the time they purchase their meds, it's just wiped away. So again, when I have clients that call me and, well, Miss Wall, I'm not going to qualify. I don't qualify for anything. I don't qualify for anything at DSS, or I just have too much money. I said, well, how do you know you have too much money? Let me qualify you first. Let me see if you meet the criteria. And a lot of times they're surprised because they've been turned down by so many local or state type programs, which again, look at your income and resources. The pharmaceutical manufacturers do not look at resources. So I don't normally, well, they want me to throw numbers just a little bit. last year, I think savings were exceeded $1,500,000 with the program, with savings for the fiscal year. My goal this year is $2 million. So, and what I mean by that, I'm not a numbers person, but I know that numbers means that I'm helping more people. And that's what I want to do, is to make sure. So if it doesn't affect you, you may take all generic meds, like, that doesn't have any impact on me, what Mrs. Wall's saying. You may know someone. We all talk about our homeowners insurance going up, our car insurance going up, our meds going up. If you hear a loved one or a friend saying that, say, you know what, I met this lady, Miss Wall. She's at the senior center. I don't remember her number, don't have her card, but if you call the senior center in New Hanover County, they'll direct you to Miss Wall. So again, when I have clients, the interesting thing as well, when I talk with them, do an assessment, sometimes I find out that they qualify for a level of Medicaid assistance that they didn't realize they qualified for. And that could be maybe not Medicaid insurance, but to pay for the Part B premium. Is everyone familiar with that? You have a premium that comes out of your Social Security check for Part B. Well, sometimes you may not qualify for full Medicaid, but there is that level to where it would pay for your Part B premium. And again, they're looking at income and resources. But the positive side to that, it's not just to pay for your Part B premium of Medicare. You would then automatically qualify to have lower copay cost on medications. So Part B, you'd have low copay on medications. You will also be assisted to a certain point with the premium of your Part D plan. So that's another win situation. Again, with the premium of your Part D plan, Part B paid, and lower copays on your medication, and there's one other thing that it assists with, very important. Oh, and in some cases, if you qualify for that level of Medicaid, you don't have the donut hole or gap. So I have found, in speaking with a lot of clients, doing an assessment, they don't need just that application through the pharmaceutical company. I'm able to refer them to adult Medicaid, or I can do what's known as an extra help application through Social Security. I do those online. And then that just fixes everything. That fixes for all their medications as far as out-of-pocket copays. Yes.
So are you saying that you can get prescription assistance from the pharmaceutical companies even if you're on Medicare?
Absolutely. I would not hesitate in saying that 99% or 98% of my clients have Medicare Part D.
Okay.
And you'll see it on TV a lot. They'll mention different medications and they'll quickly say something about AstraZeneca, AZ&Me. Well, I'm the person to go to for that. So if there's a medication that you need assistance with, or again, it causes you to go in the donut hole, I do those applications. I have that connection with the physicians in New Hanover County and the nurses, so they're used to Ms. Wall's applications. Most of my referrals, I would say 90% of my referrals are from physicians in New Hanover County. So it's a large, but that's because I've been doing it for 9 years. It wasn't that way in the beginning, but there are programs out there through the manufacturer, and it's not divulging too much of your private information. They're not looking at bank accounts, savings accounts. It's strictly income-based. Some require an out-of-pocket spending on other meds, but that's something we would talk about. So that's basically what I do, is to help people to be able to take their meds, to remain healthy, not to skip medication. I've spoken with a lot of people, and it's important with our loved ones to know, are they taking all their insulin? Are they taking, there is help out there. I can't say it's always everyone's approved, but a large percent are, because they look at income only. And every company's different. So if you speak with someone and they're like, I tried for Trulicity or whatever medication, every program's different. So if they don't qualify with one manufacturer, doesn't mean they will not qualify with the other manufacturer. They're all different guidelines. And it's not for you to be stressed about it or your loved one to be stressed about it, worrying about it. Let me do all the work. That's what I get paid to do. And then a lot of times I'll find that there's other needs, other services. All of my clients, unless they have insurance from where they retired or state, majority of my clients, they're referred to Fred, to the SHIIP team, because they are wonderful. It's very competitive with Part D or an Advantage plan. So I always call them insurance checkups, and I'll talk, Mr. Smith, did you have your insurance checkup? Have you scheduled your checkup? No, Miss Wall. I'm like, got to get at it. They're busy. They fill up. And it's so important because a plan may be good this year, but it doesn't mean it's going to be the plan for you in 2023. And a spouse, husband and wife, are probably not going to have the same Part D plan because they don't have the same meds. And you can't listen to a neighbor or a loved one or a friend that said, oh, you need to be in this plan. It's customized to the individual. So it's whatever you're taking is whatever plan you need to be in. I'm really going to just cut it short and not get into any other things because of time. And we're here to talk about Medicare. But I just wanted to share, let you know there are programs out there, and I'm happy to help you to get your medications. I stay on it. So I enjoy what I do. I'm passionate about what I do, and I want people to remain healthy and not stressed because of having to pay hundreds of dollars a month in medication that they don't have the money to do. So if you have any questions, I don't know if you want to hold it till the end or.
No. If there are
Okay. Any questions
please.
at all? Okay. I do have some business cards on the table. And so if you want to pick one of those up, or definitely give me a call if you have questions later. Referrals are always great too. I'm happy to help. Sometimes people don't want to share their personal with you, but just give them a card or name, and that goes a long way. Okay? Well, thank you. Thank you for giving me this time.
All right, we're real high tech here, so let me switch to Fred's slideshow. Okay, so thank you so much, Pam. Fred is also from the New Hanover County Senior Resource Center, and he is the Medicare SHIIP specialist. And if you're not familiar with SHIIP, he's going to help you understand what that is and how he can help you navigate the world of Medicare. So, thank you, Fred.
Thank you. Thank you all. Good evening, and I appreciate the opportunity to come and speak with you and give you a little bit of info about Medicare. I think it will be well received. But first, I want to summarize really quickly what Pam's message was to all of you, which is Big Pharma has deep pockets. Don't let that go. All right. So at any rate, so I am a retired healthcare executive. I worked for a military health plan, and I managed the provider relations network. So all of the doctors, all of the facilities, my job was to handle contracting and claims issues with regards to payments. I did that for 8 years. That was my last hurrah. But I failed at retirement, and here I am. Here I am, continuing to do some good, I guess. All right, so let's see if this works. Like magic. All right, so just by way of introduction, so that you know who we are, SHIIP, which stands for, well, I should be speaking on the Senior Health Insurance Information Program, SHIIP. We serve as the official Medicare counseling site through the North Carolina Department of Insurance, and we provide impartial, non-biased Medicare information to clients, beneficiaries, eligibles, to help them make the right selection at the onset of their eligibility, or as Pam said, during that checkup that we do on an annual basis to make sure that they still are in the best plan with the lowest cost. Medicare is our country's health insurance for people 65 or older, and also certain people younger than 65 if they are on Social Security disability. And after 2 years of being enrolled in Social Security disability, they become eligible for Medicare. So that is doesn't mean that you need to be 65 in order to be eligible for Medicare. This is the typical person that walks in and wanting to get about info on Medicare. They're overwhelmed. It is probably the most complicated decision you're going to have to make with the least amount of information possible, with the biggest consequences for the rest of your life. So that is the typical person that comes to us for help. There are a lot of things that unfortunately people don't understand, or they're just not informed because it's hearsay or just basic myths. Like the big one, Medicare is free. Well, maybe part of it is free. Part A is your hospitalization coverage. It is free. Part B is your outpatient services. It's not free. You're going to pay Medicare every single month this year. Part B premium is $170.10. But I have good news. For 2023, it'll be lower. It's going to be $166. Oh, yeah. So you'll see when I do the presentation. I can go and rattle off every single one, but you'll have the presentations. I just want to give you an idea of what the misconceptions are about Medicare that we hear all the time. So let's talk about the basics first. I understand that some of you are caring for older parents, and it's important for you to understand the aspects of Medicare, or you may be in Medicare enrolled yourself, but at any rate, it is going to be very informative. So this is traditional or original Medicare. Consists of Medicare Part A, Part B, and Part D. The numbers that you see on this slide are the 2023 copays and co-shares. So if you just have Medicare Part A, every single event that you are hospitalized, you are going to have a copay of $1,600. That's gone up from this year. And again, you pay zero premium to get Medicare Part A. Medicare Part B is outpatient services, and it covers 80% of that bill. We're talking about doctors, labs, diagnostics, any physical rehab, any type of outpatient service. Again, the Part B deductible is now going to be $226, which is $233 this year. I think there's a typo in that $1,164.90. I can't figure out what that is. Pardon that, please. Ignore that. Part D is your prescription drug coverage. And this year, as Pam mentioned earlier, the premium went up to $505. That's a deductible. It was $480 for 2022. Okay. Now, there are three things that original Medicare does not cover. They do not cover vision, dental, or hearing. Okay. You can have the best Medicare supplement plan for original Medicare, and that is not covered. So you're on your own on that. Long-term care, or what's called as custodial care, that is not covered by Medicare. Okay, so that's an important topic for especially those that are taking care of elderly parents. I suggest the law firm would be probably a good resource for information about long-term care. Okay. The other choice that folks have is called Medicare Advantage or Part C. And what that is you're no longer covered by Medicare. Now you are going to be covered by an insurance company that replaces original Medicare Part A, Part B, and in most cases, Part D. So it's an all-in-one plan, okay? I'm sure you see the ads on TV, or you will be seeing them now because everyone is being bombarded due to the open enrollment season. Not everything that you see on TV is applicable in this county. By way of reference, there are over 3,800 Medicare Advantage plans nationwide. They differ from state to state, from county to county. So what is available in New Hanover is not the same as Brunswick, Pender, or other counties. So it is county specific. You still pay your Part B premium. Certain plans do offer a Part B give back. So again, those TV ads, you say, well, we're going to give you, put back thousands of dollars back in your pocket. What they're referring to are those Part B kickbacks. But in New Hanover County, there's very little competition. I mean, we only have 3 insurance companies that offer these plans. Other states that have a much larger population and target, they compete with you. I mean, they'll send a limo to take you to see your doctor. Whatever you want, they'll give you because it's so competitive. But that's not the case here. The neat thing about some of these Medicare Advantage plans is that they do cover dental, vision, and hearing plans. It's not 100% coverage, but it's actually comprehensive coverage. So it's actually not a bad service they provide. And they also give you other things like the silver sneakers, the gym, transportation to doctors. So again, they try to make it as comprehensive as possible. The neat thing about Medicare Advantage plans is that the majority of them have no monthly premiums. It's 0 premium. So that's very attractive for folks that are on fixed income, simply because it's very affordable, of course. Next slide. This works. Blank slide. Okay, so advantages of the MAP plans. As I said, 0 or low premiums.
How can that be if you're not paying?
That's an excellent question. That's an excellent question. Let me explain that. Just because they collect 0 premiums from the client doesn't mean that they're doing it from the kindness of their heart. Medicare pays them to take care of that person's needs. So, that Part B premium we pay to Medicare, that goes directly to the insurance company. In addition to that, Medicare pays them a per member, per month fee. The higher quality rated they are, the bigger that fee that Medicare will pay that plan, okay? And we'll talk about that a little later in the slides. But believe me, it's big business. They make what they do quite well, all right? But you're not paying for that, perhaps, but your taxes are, right? Okay. So again, they will give you services that are covered by Medicare, as I mentioned before. If you're really healthy and you have very little need for medical services, it could be a good fit for you. There's a trade-off, and the trade-off is that there's no monthly premiums. However, you have co-pays as you need the services. Like, for instance, if you go see a PCP or a primary care provider, it's no copay. But if you see a specialist, now you're going to have a copay. I mean, it's a nominal fee. It could be $35 to $50, depending on the plan. And another thing is that if it's an HMO Medicare Advantage plan, you're limited in the providers, meaning you have to see doctors and facilities that are in the network. Again, small Wilmington, really, most providers are going to participate in all three plans, or at least one of the three. So you can very easily check with your providers to make sure that you pick a plan, if that's your intention, that works for you. Okay?
What three providers are in the Hannah?
I'm sorry?
What three providers are in the Hannah?
Sure. The three insurance companies that offer Medicare Advantage plans: Humana, Blue Cross Blue Shield, and New Hanover Health Advantage. And it's a hospital sponsored plan. It is underwritten by First Carolina Insurance. Okay? But those are it. Those are the only three insurance companies authorized to sell Medicare Advantage plans in New Hanover County. However, there is one more plan that is available for folks that are dual eligible. If they have Medicare and Medicaid, that combination affords them to get into what's called a dual special need plan, or DSNP, DSNP. Those plans are very rich in the coverage. They have literally no copays with doctors, no copays for hospital stays. And in addition, they offer services such as a healthy food allowance. Every month, you actually get a credit card that you can use towards the purchase of food items and many other things that you need on a daily basis, cost of living. In addition to whatever benefits you're getting from Medicare or Medicaid. And it's absolutely free, okay? Medical transportation, they're now expanding those benefits for 2023, so they're very, very good. If anyone has yes, ma'am.
What is eligibility to be the Medicaid part of dual?
Okay, so neither Pam or I are DHS caseworkers, but I will tell you that the eligibility for Medicaid is income and resources based. There are thresholds that you have to meet in your gross income as well as your assets.
I didn't understand that.
Shut up. I wasn't talking to you.
And it
That's-
doesn't have
that's funny.
anything to do with any illness that you have? or
No.
anything?
No, eligibility for Medicaid is strictly income based. And if you meet the requirements, the interesting thing is that for 2022, the only way that you would be eligible for that DSNP plan is you had to have full Medicaid benefits. Okay?
Prior to Medicare?
No, in addition to Medicare.
Oh,
Medicare and Medicaid together, that's dual eligibility. But for this year, in order to be eligible for a DSNP plan, you had to have full Medicaid eligibility. If you had partial Medicaid, you could not enroll in that plan. However, for 2023, that eligibility is being expanded, and if you have partial Medicaid, you're now eligible to enroll in that plan, which is great. It's going to open up a lot of doors for a lot of people. Yes.
I just learned something.
Uh-huh.
That's why I was like, partial Medicaid.
Yes. But now
That's a big deal.
it is a big deal. It's a huge deal.
Because it was always.
But now, this year, we had three insurance companies that offered the DSNP plan, right? Humana, Blue Cross Blue Shield, and the third one is not New Hanover Health. It was United Healthcare. DSNP plan. For 2023, only two, Humana and Blue Cross Blue Shield. United Healthcare has decided to exit the county. So, but the good news is the two that are left are actually expanding the coverage and the benefits, so it's good news. But as Pam said, there'll be many more people that will be eligible for that plan, and it is a wonderful plan. Okay,
Can I just ask one more question?
as many as you like.
So because there are the people who have Medicaid now, when they turn 65, they're limited in where they can go, Medicaid
Okay.
patients?
Let's just
Not,
first, a little ground rule. You don't have to be 65 to have Medicaid.
right, I'm
Remember,
aware of that.
you could have disability under 65, eligible for Medicare and Medicaid.
But not everybody takes Medicaid.
Well, no, you're correct.
So when you're, I guess what I wanted to know, when you're dual, when you have DSNP.
Right.
Are you still limited by those providers that take Medicaid?
Right. It's a wonderful question, and the answer is no. You're now expanding the access to the providers because these plans have their own network of providers that you can see. You do not have to be Medicaid only. So yes, it's truly, it opens up a whole venue of access to providers that you wouldn't have if it was just Medicaid.
Okay.
So yes, it's a very good question. Okay, so what are some of the disadvantages of MA plans? As we talked about, perhaps a limited provider network, deductibles and copays, we mentioned that. May not be honored out of your home area. That's a big one because they're very regional. Okay, so let's just say, for instance, that you wanted to go see a specialist at Duke. They may take your plan, but they don't have to take the plan. And more important, this MA plan does not have to pay for that. So you would be on your own if you had an HMO Medicare Advantage plan. However, there are PPO, Preferred Provider Organizations, Medicare Advantage plans that give you the option of saying, you know what, I can go out of network and see that provider at Duke. However, the plan is only going to pay 80% of that bill. You will be responsible for 20%. Okay, but you have the option to go out of network if you choose to do so. The maximum out-of-pocket is called MOOP, and that varies with the plans. I've seen them as low as $3,900 for the year, and I'll explain what that is, or it could be as high as $6,700. So if you were to add up every single copay and deductible that you would be responsible for if you were in a Medicare Advantage plan, it cannot exceed that maximum out-of-pocket expense. Frankly, probably 2 to 3% of the population enrolled in Medicare Advantage plans in the country. Did I do something? No. No signal. Anyhow, 2 to 3% perhaps may reach that maximum out-of-pocket, so it's not something that everyone is going to be. It's quite a lot to spend in 1 year if you had to reach that. Intermission time. America's Got Talent auditions. I have no talent, so.
I have a question for you.
Yes, please. Thank
If
you.
you're already on A and B
Yes.
and you want to go to C,
Yes.
can you come back to A and B if you
Oh
don't
my
like
God,
C?
I'm so glad you asked that question. Because it really, I mean, you're beating me to it, but it's like, well, since it's intermission time, we might as well address that. So, when you first join Medicare, it's called your initial election period, okay? During that time, you can choose any plan you like, and you are in what's called a guaranteed issue. And all that means is that there are no medical underwriting questions at all. They cannot ask any medical history, not allowed. So long as you can afford that premium and you're eligible to enroll, they have to take you, okay? So now, the first year of enrollment, we're gonna call it a trial period, okay? If you enroll in a Medicare Advantage plan, and say 6 months down the line, you said, I tried it, but I don't like it. I want to go back to original Medicare. You are protected by law. Yes. Okay. So you can choose to go back to original Medicare and enroll in a supplement plan. No worries. After the first year is up, that's when it gets a little complicated. Because now you are no longer in a guaranteed issue, meaning now you're going to be subject to medical underwriting. They have the right to look back 2 years of your medical history. If there's anything in that history they do not like, okay, I think we might go back a little bit.
Yeah, it's not still anything.
I'll let you do your thing.
No.
So, medical underwriting. If there's anything in the history they don't like, they don't have to sell you a plan. So if you want, let's just say that you're in Medicare Advantage and now you want to go back to original Medicare, yes, you can do that, but the only guarantee is that you're going to have Part A and Part B. Nothing else. So you're on the hook for what Medicare doesn't cover. Make sense?
Yep.
Okay. But now the reverse is the total opposite. If you are in a Medicare supplement plan, and now the premium is getting crazy, and believe me, I see that happen more often than you would think. And you say, can I now go to a Medicare Advantage plan? The answer is yes, a lot easier. There's this much medical underwriting to go from a Medicare supplement to a Medicare Advantage plan. Oh, okay. Can I go back here?
Yep, there is your
I
back.
just want to know where it was
You're good
before.
to go. Don't know what happened.
No, that's okay. All right, yeah, I can move on. Does that answer the question? Is it clear?
Clear as mud.
Oh, I know, I'm sorry. I'm sorry. It's,
Is that even during open enrollment?
okay, so open enrollment,
Go through underwriting during.
oh yes, there's no guaranteed issue. That's only at your initial enrollment period. You are going to be subject to that medical underwriting. Absolutely.
And what if you're still working at 65?
Oh, you mean like me? Yes, that's a good question. Thank you. These are all wonderful questions. So this is what happens. If you're not receiving Social Security disability income, or if you're not receiving your Social Security benefits, say that at 62 you decided to get your Social Security. So if you're not in those categories, then you have to actively enroll when you turn 65. And Part A, as I said before, is free. So if I'm still working at 65, like I was, and I'm covered by my employer's group health plan, then all I need to do is enroll in Medicare Part A. I am going to defer enrollment in Medicare Part B because it would be duplicative. All right. Why am I going to pay Medicare the monthly VIG for that Part B when I'm being covered by my employer health plan that I'm sure I'm paying to contribute? So you defer that. The moment that you are no longer covered by your employer's health plan, say you decide to, you turn 65, at 68, you're retired. Now you are going to be in what's called a special enrollment period. You have 8 months to transition to Medicare. But you only have 62 days to enroll in a prescription drug plan. Otherwise, you will be penalized. Okay? Late enrollment penalties. Gotta love it. Gotta love it. They will hit you no matter what. If you fail to enroll in your Part D when you were supposed to, and then later on, we get the scenarios, people that say, hey, I was healthy as a horse. I didn't take one single drug. So why am I going to pay for that Part D premium? No. Well, now you're 10 years older, and guess what? You need the meds. So now you want that Part D plan? This is what happens. The Medicare penalty amounts to 1% of the national average of a Part D prescription plan times the number of months you were not covered by the drug plan. I've seen people paying $60, $70 a month just in penalties. And that penalty is lifetime. You can appeal it, and if you win, good for you, or hire the law firm to help you with that. But it is a lifetime penalty. Okay. By the way, it's also for Part B. If you fail to enroll in Part B, you also will get a penalty, and that's a bigger penalty. Okay. So just so you know, but thank you. That's a great question. Okay, so where was I? I think, unless any more questions about Medicare Advantage? Going once, twice? All right, we're going to move on. Well, this is where we were. Okay. Supplement plans. All right, so now we're back to original Medicare. And now we're going to talk about the supplement plans for medical coverage. Remember, Medicare only pays 80% on the Part B, and you have your Part A deductible. So the supplement plans are designed to wrap around the Part A and Part B entitlement to cover the deficit that Medicare does not pay, right? Does anybody remember what I said, how many Medicare Advantage plans there are nationwide? Right. Guess how many supplement plans there are nationwide? 10. 10. That's it. That's all there is. And they are labeled with a letter, A through N. Remember the guaranteed issue? There it is. Okay. If you're outside the guaranteed issue, that's when you're going to be subject to the medical underwriting. Right now, the best value plan, meaning the best coverage, is called Plan G. Okay, if you were eligible for Medicare on or before January of 2020, then the best plan for you would be Plan F. Okay, the difference is between the two plans is that Plan F pays everything that Medicare doesn't pay. Plan G pays everything that Medicare doesn't pay except the annual Part B deductible, which this year is $233, next year is $226. But once you pay that, that's it. They will pay everything else. So if you're hospitalized, you pay nothing. God forbid you need open heart surgery and there's a $500,000 bill or $1 million bill, you pay nothing. If you want to see a Medicare a provider that accepts Medicare, you can do so anywhere in the country. You're not limited by any region. If you spend 6 months away in a different, vacation home and you want to see doctors there, fine, no problem. You're not limited by any network or region. Premiums, when you turn 65, Plan G would probably cost about $100 or so per month. So they are based on age, they're age rated, whether you smoke or not, and what your sex, male or female. Those are the three considerations that goes into determining what the premiums are. They're not static. Those premiums go up every single year, okay? It may start at about $100, and down the road in a few years, you're going to be a lot higher than that. I had someone that I met last week that has a Plan F. She's been in the plan for 10 years. Her monthly premium is $475 a month. That's ridiculous, okay? But it goes up every year. Not every company will increase their premiums by the same rate. So it's important to understand when you shop for these plans, and there are many different insurance companies that offer these plans, authorized to do so in North Carolina, you need to analyze, do what they call market analytics, look at their historical rate increases so that you understand what you can expect moving forward, and also their financial rating. Are they in good financial standing? There's a company called AM Best that does the rating for the companies. So that if they're A-rated, it's solid. If it's lower category, then it could be iffy. But you have the tools to be able to determine what might be the best company for you. The plans are standardized. by Medicare. So no matter what insurance company you buy a Plan G, it is the same coverage, same Plan G, no matter what company you choose. Any questions on that? Yes, ma'am.
What are some of the differences, just a couple, between like Plan A and Plan N?
I'll tell
Just
you.
what they offer?
So let me pick G and N, okay?
Okay,
Plan G, as I said, pays for everything that Medicare does not cover except for that annual Part B deductible of $233, okay? Plan N, same thing. They cover what Medicare does not. You are now responsible for that same Part B deductible, but now in addition, you are going to have copays when you see your doctors, okay? However, that's priced into the equation, so what you're going to find is the premium for Plan N would be lower than Plan G. So if you don't see that many doctors throughout the year, that makes sense for you.
so you're saying that, to summarize, that a supplement and a Medigap, they're both the same thing.
Say again?
Supplement and Medigap,
Yes.
same thing.
Yes.
All the plans are standard, so it's up to us as the insured to shop for price from one company to the next.
And right, and
And one
understand
plan to the next.
how they do their pricing, historic, exactly, yes, you
Okay.
got it.
Okay.
I don't know why it doesn't like it.
It doesn't like me. Any questions while we're in intermission again?
So then I wonder
I got you.
No pressure.
Good.
Hey, we got it. That's it, that's good. All right.
That's good.
am I,
No, go ahead.
Don't know if
please.
it's on some kind of,
ask for.
Go ask away. You know, you're asking questions that I'm sure other people have too, but they're afraid to ask. Go ahead.
So why would one do Medicare Advantage over a supplement?
It depends on your circumstances, on what you think is the best fit, okay? There are many reasons. There could be financial reasons. As I said, Medicare Advantages have no monthly premiums. But Medigap plans, you have to pay a monthly premium. Think of it along this way. If you go the route of original Medicare with Medicare supplement and prescription plan, you are prepaying for the services, right? So whether you see a doctor or not, you have that monthly premium you got to pay every month.
Oh, and this is, the other one's.
The other one is the reverse. You pay as you go. So if I don't need any services and I'm healthy, at the beginning years of when I'm eligible, I'm paying next to nothing. And guess what? I'm also going to have vision, dental, and hearing benefits that I'm not going to have on original Medicare. So believe me, Medicare Advantage plans are very attractive for many people. It's the fastest growing segment of Medicare as a result of, and there are many variations within the Medicare Advantage plans. You can reduce the risk, your financial risk, because they're not all zero premiums. There are other that offer plans with a monthly premium, but they expand the coverage that they give you. You know, there's one Medicare Advantage plan is almost as good as one of these Medigap plans.
I could see that.
You see? Yes, sir.
Say you've been on Medicare for several years.
Yes.
And just A and B and G.
Okay.
But if I want to go to C.
Yeah.
Are they going to look at my medical history?
Yeah, but they're only going to do this. You're good. Believe me, they make a lot of money with that. It's so easy.
Go back to A and B.
Oh, yeah. Oh, yeah. So from Medicare Advantage to Medicare supplement, that's hard. That's when they're really going to look at your 2-year history. And again, anything can say, you know what, we don't want to take you. But you can go from a Medicare supplement to a Medicare Advantage plan very easily. They have very minimal underwriting. So it's good.
Right.
Any other questions? Okay.
But they only-
So
Well, yeah. But you can only do this switching around during open
I'm going to get to the next slide that's going to answer that question, I think.
Sorry.
No, it's quite all right. It's a great question. Actually not. This is the prescription drug plan, but, you got the expert right here. So I'm just gonna rattle it off. What's a prescription drug plan? It's a private insurance regulated by Medicare, okay? You cannot have a PDP if you're in a Medicare Advantage. That's an important thing to understand. If you are in a Medicare Advantage plan that includes a prescription drug plan, you cannot have a standalone prescription drug plan. Not allowed. If you do that, they'll disenroll you from the Medicare Advantage plan, okay? Now, what happens to folks that have military benefits? Their VA, okay, they go to get their meds at the VA. Well, in that case, there are Medicare Advantage plans that are MA only, they're medical only. Gives them the freedom to continue to get their meds at the VA, okay? So that's an important understanding. We talked about the penalty for not enrolling. You can change your plan, do that checkup that Pam mentioned earlier every single year during Medicare open enrollment. And that time frame is October the 15th to December the 7th. I am bombarded with calls, folks wanting to make appointments, and we welcome them, okay, because that's our mission. That's what we do. In fact, in that information that I left behind, you're going to find the Medicare SHIIP appointment line, and you have my card. If you'd like to schedule an appointment for yourself or a loved one, then please reach out to me, and I'm happy to schedule that for you. Make sure you have your Medicare info available. It's really important. Premiums and copays depends on the drugs that you take. Every year, the formularies change with the prescription drug companies. So it's important to review and see if you're still in the best plan, best bang for the buck, so to speak, and the coverage, because sometimes they can exclude drugs from one year to the next. That's all part of that review process that we do. Pam mentioned the help available if you have limited income, so I'm not going to redo that. The deductibles could be as high for 2023 as $505 per year. You got to make sure the plan you select covers the drugs that you take. We help you with that. We input all of your drugs into the system, and it'll tell us, yes, it's covered, no, it's not. If it's not covered, Pam Wall is the person to make sure that she can get help for you. Do not pick a plan based on premium unless you do not take any drugs. That's an important consideration. So when you look at the available plans based on your needs, you're going to find a whole slew of them. Now, the cheapest one could be $11 a month. And you can have another plan that's $35 a month. But that's just the monthly premium. So what you need to look at is, what is my total cost for the year, including the monthly premium and the copays for the drugs. And we provide that information to you. So you really want to look at the lowest overall cost as being the best bang for your buck. Okay? How am I doing on time? Am I?
7:02.
Okay. Yes, ma'am.
One quick question. Number 3, lifetime penalty for not,
Yeah.
and can you just go over that one more time, please?
Sure. The Medicare penalty for late enrollment to a prescription drug plan,
Point D.
Part D, it is 1% of the national average for the Part D premium. I think is around $35 a month, if I'm not mistaken, times the number of months you went without coverage.
And that's upon your initial enrollment.
That's when you decide you want to enroll a late enrollment into a prescription drug plan.
So you're saying that when I hit 3 months before I turn 65, if I don't take a Part D,
Or 3 months after.
right, or 3 months after, if I don't take a Part D.
Yep.
And then 8 months later, I
Well,
want a Part D.
Right. That your penalty is going to be kind of minimal.
Right.
But we have people that go 10 years without a drug plan.
Oh,
You know what I mean? Yes, ma'am.
Another thing to mention too, since you said 8 months,
she may decide in 8 months that she wants to, but she's not eligible
Right.
until next open enrollment.
Remember, you have a 60, and also you have
Yeah.
the enrollment. It's okay. So now you're employed, and you are not going to retire, and you're going to lose your employer group health plan that includes a prescription plan, right? You have 8 months to decide to enroll in a Medicare plan, but you only have 62 days. 62 days to enroll in a prescription drug plan, or else you will be penalized. And it's one of those little footprints that you really don't know about. And we see that, we had one actual case that one of our volunteers did, and he was perplexed. Well, what happened? How come? Well, that's a little footnote, 62 days. Yes, sir.
Let's see, 11 years, used to be a.
Okay.
My drug. So
Yes.
is that, so I'm okay? if I
Yes, sir.
decide to do a part-
VA coverage is called creditable coverage for Medicare. So if you have VA coverage, and that's like your prescription drug plan, okay? So you enroll in a plan, you only enroll in a medical only because you're getting your medications through the VA, all right? If at any point you said, you know what, I no longer want to do that, I want to now have a prescription drug plan, you can absolutely enroll in a PDP plan without penalty, because that VA entitlement is considered drug coverage for Medicare. Okay. Okay, so Medicare provides plan comparison tools at medicare.gov, or you can call 1-800-Medicare. I'll have more info on that in the later slides. Or, as an easy option, reach out to us. We're here to help. It'll be our pleasure to go over all the details with you one-on-one to make sure that you have impartial info and you can choose the best plan for yourself. These are the Medicare enrollment periods that this lady Elaine mentioned, so let's go over them. Initial enrollment period on the 65th birthday, 3 months before and 3 months after enrolling Part A or B, or Medigap, Medicare Advantage, and Part D. Open enrollment, again, the annual election, the review period. If you're currently in Medicare and you want to go over your plans to make sure they're still the best, that is between October the 15th and December the 7th. Then there's a general enrollment period, January 1st through March 31st. That gives you the ability to enroll in Medicare Part A and B if you did not enroll when you were first eligible. It's also the time where you can switch from one Medicare Advantage plan to another if you wish to do so. Okay? That's the time frame for you to explore that. Special enrollment period, we talked about that earlier. That happens when you, after employment coverage ends, and then you need to secure your Medicare coverage. There's also another there are multiple types of special enrollment period, okay? Let's say that you're in a Medicare Advantage in a different county, and now you move to New Hanover County. You're gonna have to enroll in a new Medicare Advantage plan that works here. So now you have a special enrollment period. And that's typically 2 months from the date that you move to New Hanover County or wherever you move to, okay? So there are multiple types of special enrollment periods, but it addresses those types of circumstances. Okay, so this is the info that I wanted to leave last for you, which is, how do you get help? Enrollment in Medicare is done through Social Security. You can use their website, or you can call the local office and they can help with that. Information about Medicare, how to monitor the services, compare providers and facilities is done through the website, medicare.gov, or you can contact them directly. Medicare uses a STAR system for quality ratings in facilities, and it's a big deal. So I think that at this time, we do not have a 5-star Medicare Advantage plan in New Hanover County. And we do not have a 5-star hospital system in New Hanover County, okay? The quality rating is across many different areas that is examined by CMS, Center for Medicaid Services, and that's how they rate it. The plans that have their highest star rating get the most monies from Medicare. If you have a low star rating, you're going to get less money. And in fact, your standing with Medicare is at risk. I think it's kind of happened recently to our local hospital. Okay, so it's a big deal. All right, so Medicare quality ratings are, and you know, I can only tell you that from the healthcare standpoint, we put a lot of pressure on providers and facilities to make sure they had the highest rating. And if you didn't make it, we want to know what's your plan of action to improve on that. And let me see a specific plan of action to make that happen, because we care about our members making sure they have the highest access of quality service. Yes, ma'am.
What do you mean by facilities?
Oh, oh, no. Well, I mean, the CMS rating, typically, the star rating is going to be for hospitals. It's going to be for skilled nursing facilities. It's going to be for, I think, surgical centers. Okay, it's not across the board. Providers too. Providers get rated based upon their quality of service. So all that information is available for anyone at Medicare.gov. You can compare and look at. Oh, but you can look it up by county, by state, by name, any which way you want to.
What kind of a rating did you call it?
Star rating. Yeah, star rating.
Why doesn't New Hanover County have a good rating?
Well, it's not a bad rating. It's a 4 out of 5 stars. We just don't have a 5-star.
Can we do anything to get it to a 5?
Ask the hospital. What's their plan of action? How many new nurses are they going to hire? I mean, you know, I mean, CMS demands them to demonstrate their ability. In my world, it used to be called a corrective plan of action. You know, that's what it is. Medicaid. Remember we talked about Medicaid eligibility? That's how you contact the Department of Health and Human Services. You can either do that online through epass.nc.gov, or you can just call the local office and they will help you with any Medicaid information. And how do you contact us? I pounded on this drum all night long. So you can reach out to SHIIP. That line is the main office for SHIIP is in Raleigh, okay? But each county has a SHIIP office. Ours is at the Senior Resource Center. So again, my business cards and the SHIIP appointment line are on the table. Please help yourself. And if I can be of any help, do not hesitate to reach out, okay?
How many SHIIP representatives do you have at the?
Not enough. Thank you, because you just gave me the biggest segue of all the evening. We are in desperate need for volunteers. Please do not hesitate to learn about volunteering at the center for SHIIP or any other service for that matter, but we desperately need to have more volunteers on board. We just don't have enough to meet the demand.
Do you have to, how knowledgeable does one need to be?
You have to undergo training. It's all, you know, you read the material, you you need the basic understanding of Medicare, et cetera.
How many hours is the training?
Maybe.
It's been a long time. I don't remember.
Yeah, I'm looking at her. She's not helping me. Okay. All total, maybe 20, 30 hours, I'm going to say. You know, you're going to do, you have to understand the material. You have to go through it. You know, we want to make sure that you know the subject. But, you know, there's help along the way. Believe me. I mean, all the tests are open book. We'll help you. If you're interested, don't hesitate.
I think you may out of her, I think she asked the question, do you have to be licensed agent? They don't.
Oh, no, no,
allow
no, no,
licensed
no.
agents
No, I'm
to,
sorry, I missed that.
yeah.
No, you don't have to.
Because you can't solicit.
Correct.
Right, yeah.
Can I, just one general question, just to review. You can get Part A, Part B, and Part D without it being called a Med Advantage? Or no?
Well, Part A and Part B is Medicare.
Right.
And Part D is a standalone. Yes, you can get just a prescription drug plan if you're not enrolled in a Medicare Advantage plan that has a drug plan.
Okay, so you can get a standard, okay, that's what I thought.
Right.
I just wanted
So
to make
you
sure.
remember the example of a VA benefit? So if I want a Medicare Advantage plan, medical only, I can enroll in a standalone prescription drug plan. But if I choose a Medicare Advantage plan that has a prescription drug plan, no, you cannot enroll in a separate drug plan.
But if you went back to
Original?
that, would you be charged a penalty because you didn't?
No, because if you
go
have,
through the Med Advantage?
right, if you,
Okay.
exactly. If
So
that's,
then
again,
you
that's
do it
creditable
wrong.
coverage, you
Okay.
can do that transition, yes.
Gotcha.
Yes.
Okay.
Any other questions? Well, thank you all very much for putting up with me and listening to this.
Well, thank you for all of you for coming tonight. Our next program will be November 8th. It's Help in Your Own Backyard. They're going to be presenting some of the resources that you can have here in your local community. Obviously, the two we heard from today are great resources. As I said, they're non-biased. They're just free resources at the Senior Center for you. And then the other program that I talked about, the National Symposium, is November 4th. So both of those are next month, one on the 4th and one on the 8th. And that is streaming. And our program is both live. And then last month we had 50 people that were streaming, though we love to have you come out in person so you get a chance to interact with our presenters. And the other benefit of that is just to be able to interact with each other and begin to build community with other adult children of aging parents. So if there's anything else I need to cover.
Yeah, I
Yes.
just wanted to, if anyone would like to have any one-on-one conversations with me this evening, I'm happy to stay behind and speak with you if you'd like. So,
Yeah. And as he said, his information is at that back table just in front of Jennifer there. She can wave at the refreshments. So if you want to pick up any information there too. And I think that's everything, other than just leave us your feedback on the ACAP feedback form. You can just leave that right on your table. And if you have any questions for any of the leadership team, you can find us with the green shirts. We're pretty easy to see. So thank you. Oh, go ahead.
hopefully they sign it.
We have their sign in too. So thank you so much for coming out and have a good night.
Thank you very much.
So sorry about the technical.